Hey, thanks everybody for being here today. My name is Dave Phelps, the President of Berkshire Health Systems. It's a pleasure to welcome you here today for a very important announcement. We're here today with board members, members of our medical staff, members of our leadership group, employees, members of our community that share the same interests we do and the work we do. We're grateful to all of you for attending. We expect this. We're under strict orders from Mel to get this done on time. He has other plans for today, so it may not include us. But thank you all for coming, and I want to especially thank Mayor Yang. It's tough being a mayor. And he always finds time to be here with us. We're doing something that's important to this community, so we appreciate very much. I want to apologize to him in advance. He may have to leave early. I don't want anybody to think he's rude. He shuffled his schedule around so he could be with us for at least most of what we'll talk about next. Thank you. I also want to thank the media that's joined us today. We appreciate your interest in the subject and the fact that you've covered this and share the story of Black community. We're grateful. Thank you. So I want to extend a special welcome to our honored guest, Mel Zuckerman, founder of Canyon Ranch and the Canyon Ranch Institute. Dr. Carmona, the 17th Surgeon General of the United States, is president of the Canyon Ranch Institute. Jennifer Kay, the executive director of the Canyon Ranch Institute, and a local guy now, Reggie Cooper, who requires little or no introduction, but he's the managing director of the Canyon Ranch of Lennox, and almost all of us here know him. We've asked you here today because we're announcing a partnership between Berkshire Health Systems and the Canyon Ranch Institute that we expect will begin to develop a culture of wellness for our community. And let me emphasize, we mean our entire community. Before we begin, though, I want to pay some special thanks to Mel and Ian, the superintendent who couldn't be with us today. But Mel will bring back our messages, I'm sure. That we're grateful to them for their extraordinary vision and commitment to wellness that led to the creation of the first Canyon Ranch in 1979 in Tucson, and for choosing the Berkshires to be the location for the second Canyon Ranch, known as Canyon Ranch Lennox. Or as I'm starting to learn that if you work there, it's affectionately just known as the ranch. It makes all communication easier. So we're grateful for what Mel's done and the vision he's had. And of course, for the generosity and personal efforts that have led to the creation of the Canyon Ranch Institute, an organization whose mission is a call to arms for health and wellness for all people. Their goal is to bring the best practices of Canyon Ranch and their partners to help educate, inspire, and empower every person to prevent disease and embrace a life of wellness. Shortly, we'll hear more about the Institute, its work, and our new partnership with more. But first, though, I'd like to remind everyone of the significance of Canyon Ranch Lennox. It opened in 1989. It's attracted thousands of people to Berkshires from all over the world and the country. Many of them fall in love with the Berkshires and return both to the ranch and into the Berkshires. They're attracted to all the attractions that we're so proud of. It employs over 700 people. The ranch has had such a significant impact on our community and our town. We're grateful now for all of you that have done. Think of the professional opportunities that ranch has created for members of our community. So now we'd like to thank you. At the same time, Canyon Ranch is known to be an exceptional corporate citizen. Its general manager, Reggie Cooper, third generation hotelier, and a dedicated investment member of the Berkshire community. He serves as the chairman of One Berkshire Strategic Alliance and Foundation, and past chair and board members for the Berkshire Visiting Bureau, Berkshire Chamber of Commerce, Berkshire Economic Development Corporation, and senior board of Trinity Church of Lennox. If you attend a charity event like today's for personal experience in Berkshire County, designed to raise money and help somebody who's poor, you will run into Reggie Cooper. We appreciate it. He reflects the values that Mel would expect from any leader of one of their organizations. He's played an important role in making today's announcement a reality. I want to thank him. As many of you know, over the years, we at BHS have made significant progress in improving the services we offer to our community, both the array of services we offer and the quality of the services we provide. We've made and continue to make substantial investments in our people, our facilities, and our technology. These investments have allowed us to improve access to care and to ensure essential community services remain available throughout Berkshire County. And despite the challenges we face, we keep moving forward so we can be ready to meet the needs of our community and to be certain that essential community services are preserved and enhanced. A good example is the development of our cancer center, now underway. You can expect an announcement on the completion of funding later this summer. Soon, the community will receive an invitation from us and the physicians of Berkshire Community College and Oncology to tour phase 1 before we begin to receive patients. The result of our work will be better coordinated care for our patients and their families and a stable work environment for the BHO physicians currently challenged by today's reimbursement climate. Yet another example is recently we became the partner of Williamstown Medical Association, a private primary care practice serving northern Berkshire County residents, and challenged too by the reimbursement system and facing very difficult decisions. With our support, the talented physicians, practitioners, and staff there can focus on the care of the 12,000 patients who depend on the care. So it's clear these investments paid off, but today we're talking about all of them. Our hospitals provide exceptional care to the residents of Berkshire County. Bmc has received the Distinguished Hospital Award for Clinical Excellence from Health Grades more than once. Those of you who don't know what Health Grades is, it's a provider of comprehensive information regarding the quality of services offered by physicians and hospitals. This award places BMC in the top 5% of more than 4,500 hospitals nationwide for the performance. BMC has also received quality recognition in emergency medicine, cardiology, stroke care, pulmonology medicine, critical care, cancer care, orthopedics, and surgical care. And the same is true for Fairview Hospital, our critical access hospital in Great Barrington. Fairview continues to receive accolades and awards for the care they provide to our South-County residents. Fairview Hospital has been named one of the top rural hospitals in the country. Perhaps less known to many of you is we also support numerous community programs and partnerships, which I encourage you to read more about in the BMC Improving the Health of Our Community handout, which is available at the entrance of the auditorium. We're proud of our accomplishments. You can expect us to continue to work to ensure our community has access to the comprehensive healthcare services it requires, and those services will be equal or better quality than our residents will find if they were to travel to a large metropolitan medical center. Hypothetically say Boston. That's our goal. Independent data confirms we're successful. But despite our efforts in our community and the communities that we face a grim reality. We face a public health crisis that, left unchecked, will cause a human and fiscal crisis of unimaginable significance to us and future generations. In a few moments, Dr. Carmona will speak in more detail about the challenges we face as a country and as a community. Though we're presented with these health challenges, we don't need to start from scratch. We've done some good work, and now we have a very good, experienced partner. Through the Berkshire Health System's Wellness Program, we've seen impressive results and learned a great deal over the years about providing a program designed to address the health and wellness of our employees, and in some cases, corporate members of our community participate in our services. Our program has made a significant difference in the lives of our active participants, and we can demonstrate that it's reduced the costs associated with providing care to our employees, saving the Berkshire Health System significant amount, and also saving our employees significant amount of money, because we're partners in healthcare costs in this country. Over the past 3 years, while others around the state and nation saw significant premium increases, our costs have been flat. And the result has been that our employees' costs have been stable. And their benefits since the inception of the program have been enhanced. Unusual these days, with rapidly rising premiums and significant shifting of costs to employees have become normal. If we were to assume a modest 3 to 4% increase over the last 3 years, significantly less than what most people have seen with the premiums. We will avoid between $9 to $12 million in cost. Because we're a large self-insured employer, those benefits accrue to us and our employees in our community, helping us make investments in things like an cancer center, and helping to save an essential primary care grant. 12,000 patients who depend on that to see the doctor. The benefits we earn stay in our community rather than finding their way with distant insurance companies that often cares little about our community and perhaps even less about our responsibilities to it. And beyond fiscal savings, I know firsthand what a mature wellness program can do to those who participate in it, because I'm a participant in ours. With that, we shall move forward. How do we do that? We now have confirmed that I can do nothing. So the answer to the question, how many executive does it take? It's 3 if you're ever asked the question. It takes 0. So startling confession is that picture on the left was a good picture to show. So, I was, no, that's okay. I don't think we want to keep it there forever. There's taking pictures of it. So anyway, let's back to the text. I get in so much trouble every time I get off the script. I have to admit that when I was first approached about a wellness program, I was skeptical, but supportive. And it wasn't until I was approached by folks that said if I participated, there might be a good message to our employees. They would see it's important to be in leadership, and maybe they too would want to participate. So I did. And it led to a journey. Most of us never expected it to happen when you go to your wellness visit. But I ended up for some time with a diagnosis of type 2 diabetes. It wasn't routine, obviously, but it continues to be a life-changing event. I've dropped about 40 pounds. I've maintained my new weight over a considerable period of time now. I've been educated about food and how to eat sensibly, and I live a more active and healthy lifestyle. In some part, thanks to an early diagnosis, I suspect. I'm fortunate that with the changes I've made, I'm able to control my diabetes with medication. My physicians tell me I have an excellent chance to avoid complications commonly associated with my diabetes. It takes work, support, some discipline, but it's all worth it. And if I stay compliant, it actually saves a lot of money. And I can care about that again. If I stay compliant, the cost of caring for me when I hit that age, which once seemed so far off, not so far off, it's going to be cheaper for our children to take care of them. I have a responsibility to think about that, so I think that's key. So that's great. Now, I was 59 when I got my diagnosis. And I believe Mel had an aha moment as well in his life, which led to the creation of the ranch. And it was late in life. But we're living proof that it's never too late to start living a healthy lifestyle and to achieve the substantial benefits of better health and wellness. Now, we need to recognize that I've had benefits that most people in our community don't. That's what it is. I have a job at BHS that provides all employees, including me, with great benefits that include the mature wellness program. I have a supportive family network in Carolina. My wife's here. Somehow she thought this would be helpful. Thank you. And now I know how to live a healthier lifestyle, and I have the means to build on what I've learned and continue to engage in healthy activities. But only a small percentage of our community enjoys the wellness and support systems that I have access to. We need to make investments in programs that provide similar opportunities to our community, and that's what we're announcing today. Our wellness program required significant investments before we began to see the benefits I've discussed with you. We'll be working with our business community over the next year, 2, 3, 4, to find a way where even the smallest employer in Berkshire County can have access to comprehensive wellness programs like ours that will be affordable and, if successful, allows them to achieve the benefits of stable premiums and health in their workforce. It's one of our goals. In the Berkshires, we offer some of the best care in the country. But recent studies have shown that we're a long way off from achieving our goals of a healthy Berkshire County. According to recent rankings from the Robert Wood Johnson Foundation, which conducts state-by-state rankings of the health of every county in the United States, Berkshire County ranked 11th out of 14 counties in Massachusetts in quality of health life measurements. Add to the fact that Berkshire County's median family income is at least 25% lower than the median statewide income, you can see that we have a lot of work ahead of us. In a few moments, Ms. Kay will speak about the Canyon Ranch Institute and the work of our partnership. The results that Canyon Ranch Institute has achieved with its partners in other parts of the country are extraordinary. And we expect the knowledge, skills, and experiences of all participants to influence our overall healthcare delivery program here in the Berkshires. And by incorporating the principles of the program into all of our interactions with our patients and our community, will help us achieve our goal of a healthy Berkshire County. But before that, I have a tremendous honor, and that's to introduce the 7th United States Surgeon General, Dr. Richard Carmona, the President of Canyon Ranch Institute. Never did I dream like that. Anybody who I grew up with. That's true. My wife is not.
I did.
Yeah. Born in New York City, Dr. Carmona experienced hunger, loneliness, and health disparities throughout his childhood and teenage years. After dropping out of high school, Dr. Carmona enlisted in the Army. At the end of his service, he had become a combat-decorated Special Forces Vietnam veteran. After returning from the war, Dr. Carmona received his medical degree from the University of California in San Francisco. He's trained in general and vascular surgery and completed the National Institutes of Health sponsored fellowship in trauma, burns, and critical care. He also holds a Master's of Public Health from the University of Arizona. In 2002, Dr. Carmona was nominated by President Bush to become the 17th Surgeon General of the United States. As Surgeon General, Dr. Carmona focused on prevention, preparedness, health disparities, health literacy, and global health. In 2006, Dr. Carmona was named to the position of Vice Chairman of Canyon Ranch and President of the Canyon Ranch Institute. He is also the first distinguished professor of public health at the Mellon Eaton Zuckerman College of Public Health at the University of Arizona in Tucson, the first distinguished professor of health promotion and entrepreneurship at the Ohio State University College of Nursing. It's an honor to present to you, Dr. Carmona.
Thank you, David. Yes. This may not be equally technically challenging. Well, thank you. This is a tough act to follow. You have a wonderful CEO who's also a stand-up comic, and a wonderful guy. It works. And of course, a poster child for health, because you've seen the metamorphosis that he's undergone in the past. So to have a leadership that really, talks the talk but walks the walk as well, and being a poster boy really is amazing. Thanks for the nice introduction, but I usually hope for shorter ones, because once people hear that, then I end up feeling a lot like Ricky used to say to Lucy, you got a lot of explaining to do. It doesn't engender a lot of confidence in the public when they find out that Surgeon General is a high school dropout. But anyone says, well, it was just a federal appointee, it's not a big deal. But I did recover. I'll tell you just a quick story before I go on. When when I was in the office of Surgeon General. It's a 4-year statutory term, and usually 5 or 6 times a year during graduation, you do graduations, big service academies, universities, and my team got a request for me to go do a graduation at a high school. And they wouldn't even tell me about it because they said, well, you're too busy, you can't possibly do that. And I said, well, why not? And they said, well, you're busy. And I said, what high school was it? And they said, it's DeWitt Clinton High School in the Bronx. And I said, that's kind of my alma mater. I didn't graduate. I said, I'd like to do that if you don't mind. And the team said, no, you can't. My aide-de-camp, who's a commander, told the team, who here likes your job? And I said, make it happen. So I went and did the graduation, and was really fortunate I did the commencement address because 37 years late, they gave me my high school diploma. My mom's, we came from a poor family, and my mom's goal was just to live. She used to say in Spanglish, I just want to live long enough to see one of my kids graduate, show them in high school, because nobody had graduated from high school. So I've exceeded my mom's expectations. I'm so thrilled to be here today. I've been here before at the Berkshire Health System, and I gave a grand rounds and some talks a number of years ago. And back then we had some ideas, and Cindy Geyer, one of our docs at Canyon Ranch, and a few others said, we should do something with the medical center. I mean, it's really a wonderful place. I mean, it's a center of excellence. You have residents, you have medical students. The quality of care is extraordinary. The awards and accolades they receive for the great work they've done, you've all done over the years, is extraordinary. To have such an asset in the community is wonderful. But, some of the people who came to me and Jen and to Mel said, well, what else can we do with this asset to make it better? Yeah, we do a lot of good things. What else can we do? And that's where this all started over a number of years ago, and having these discussions. And during that time, I had the privilege to start the Institute. But it's here because of Mel and Enid and their vision, because they recognized how grateful they were for all that they had been able to achieve. And Mel's aha moment has now inspired hundreds of thousands of people all over the country and the world, just as it done as to Dave. And I don't want to take credit for it because I can't. When I left the office of the Surgeon General after my statutory term, I had a lot of options. But it was Mel and Enid who said, why don't you come and join us? Why don't you be our vice chairman and work this institute, because we really want to explode this whole concept of health and wellness and prevention. And it was fortunate that I said yes, because it's been a wonderful partnership and we've gotten to do many great things. So you say, why? What's important? Why are we doing this? Look at the data before us. We have 9 million children, probably closer to 10 now, who are overweight or obese. 2 out of 3 Americans overweight or obese. We spend $2.8 trillion a year on what we call healthcare in this country. It's really sick care, folks. It's 18% of our gross domestic product. 75 cents of every dollar we spend, every dollar is spent on chronic diseases, most of which are preventable. So the disease burden that we've inherited as a nation, a lot of which you care for here in an extraordinary way, that disease burden, a lot of it is preventable. And as we look at the trajectory of the rise of the cost of care over the next decade, we'll go from 18% to somewhere around 23 to 25% of our GDP. So we'll go from about 2.8 trillion where we are today to close to $6 trillion. The bank's breaking today, folks. So if for no other reason, we are compelled to do something because the economics tell us the system can't go on any longer like this. And yet the burden, the great part of the burden that we're dealing with is preventable. It's lifestyle. It's stuff that Mel and Enid in the 70s with his aha moment said, there's a better way to do this. People continue to make these bad choices. I saw it in my old world where I was a trauma surgeon and a critical care doc. 3 out of 4 patients I admitted every day to our trauma center were there for a reason that was preventable. They made bad decisions that particular day. I mean, a lot of, not what we call the knife and gun club and domestic violence and drunk drivers. But then there's a whole host of people that make decisions their whole life that are poor. They smoke. They lead a sedentary life. They gain weight. They get type 2 diabetes. And this just keeps adding on. And if you get type 2 diabetes, it's likely you're going to get cardiovascular disease. It's likely your kidneys will fail. Your eyes will fail over a lifetime. The cost of that is astronomical. And you explode that out over 310 million people in the United States, it's drowning us. That's why these programs are so important. The government can't solve this problem for us. This problem has to be solved by us. And by bringing these programs, we have a dozen or more partnerships now around the country. We've proved the concept that it works. Jen will tell you a little bit more about it in a little while. But the importance of it is we drive down the cost of healthcare, we improve the quality and quantity of life at the same time. And we use the considerable assets of the Berkshire Health System in a way that maybe wasn't anticipated. You got the great care, but really exploding it out into public health and really making people healthy. You know, I was speaking with Dr. Pettis this morning. We both come from the clinical world, and we get compensated for taking care of sick people. And that's the problem when people do public health, do health and wellness. Yeah, there's no business model for that. How can I afford to do that? The real answer is you can't afford not to do it because the system is falling apart now. We can't afford the trajectory we're on. So the system is turning slowly. We are right-sizing. We're moving toward optimizing health and wellness. We see CMS and other payers rewarding those who will take some risk in that arena. And also, we see them disincentivizing others. People who smoke pay more in insurance. You know, if you have a lot of accidents in your car, you pay more. So we're starting to see more of that, both positive and negative. But we have an opportunity here to do something that's truly extraordinary. And that opportunity is because all of you in your community have decided it's important. That leadership like Dave and others here, and Mel and Reggie at Canyon Ranch here, have come together and say, let's put our considerable resources together and let's build something that we can be proud of and maybe make it one of many pilots that can be in this area, that we can expand out throughout this community in Massachusetts to help the underserved populations. We started out 5.5, 6 years ago in the first program in South Bronx. About 40,000 very poor Hispanic people living in an area used to be called Fort Apache, one of the highest homicide rates and crime rates in the country. And we are turning their life around. And with Jennifer's leadership and our team's leadership, we purposely go into these communities that have the worst health metrics, the worst social determinants of health. The poorest people, no jobs, single moms, to prove the concept that this can work, to prove that it can be sustainable, to prove that the economic model will work as well. And we've done that. We're generating data every place we are. Jen will tell you more about that also. So we're most proud. But most importantly, my job is to thank all of you for the support, for being here this morning, for hearing what your community leaders want to do with you, for hearing about the vision that Mel has had, the leadership that Reggie's done through our Canyon Ranch here, and of course the leadership that Dave has demonstrated and what the possibilities are. And if you know our little mantra in Canyon Ranch, it's the power of possibility. And look what happened when Dave did on his own without a program and just said, I'm not going to deal with this anymore. That's what we need to happen. If we don't, there's no political party, there's no elected official that's going to be able to solve this problem. It's too big. It really takes a cultural change. And as Surgeon General, I used to tell my team the one degree that I really needed to be a better Surgeon General of the United States was that of an anthropologist. Because ultimately, all of this information is about changing a culture, about delivering culturally competent, health literate messages to a needy population to do one thing only, achieve sustainable behavioral change. And with that, the health metrics change. People get healthy, cost of care goes down, and it's an absolute necessity. So I want to thank all of you for your commitment. Please help Dave and the team here at Berkshire to make this a successful program. With his leadership, we are sure it's going to happen, but it's going to take everybody in the community, everybody getting online, talking to your friends, and we'll help you with the roadmap because we've done it a number of times, but it really is the leadership here. And I know Mel and Enid are so proud of being able to give this intellectual property to the communities they love to make those communities better. Now it's my privilege to introduce someone I call my adult supervisor. And Jennifer was with me in Washington as a speechwriter and communications person. And when Mel challenged me to run his institute, when I came, I thought I need capable people. And Jennifer had left government. She had been at NIH, worked at the White House, worked at CDC. She's got an extraordinary resume. And I thought, how can I get her to come to Tucson, which is where our headquarters was? Because she had a big job, making very good salary, a lot of benefits. And I thought, okay, I have an idea. It was February. And I said, Jennifer, will you come out and see me? I'd like to talk to you about a job. And, you know, we trust each other. You know, we've kind of been in the battlefield of Washington, which is about the worst combat I've ever been. And she came out, and I said, look, I want to offer you a job. And it was 70 degrees and sunny. And the ranch in Tucson is much like the ranch here. It's a spiritual. As soon as you arrive, you get this sense there's something special. It's like you just relax. And she came and she kind of fell in love with the place. And I said, look, it's 20 degrees in Washington. It was snowing. Do you really want to go back? And I'm going to give you this great job. I can't pay you what you made in Washington, but I can guarantee you that this job will be transformative in your life because you will affect the lives of people all over the country. And you have the opportunity here to build a program that's going to be meaningful not only for Canyon Ranch, but for every place that we're able to embed these Canyon Ranch Institute programs. And she said yes, and we have been the beneficiary of her leadership ever since. Jennifer Gable.
Good morning. Thank you, Dr. Cremona, for that introduction. That was pretty wonderful. I hope somebody got that on tape. I'll tell my mom. So as Dr. Cremona mentioned, my name is Jennifer Cave, and I serve as Executive Director for the Canyon Ranch Institute. Canyon Ranch Institute is a nonprofit organization, and we work through partnerships with other nonprofits, corporations, healthcare organizations, as we're talking about today, academic institutions, and most importantly, communities. We translate the best practices of Canyon Ranch and our partners around the country to people to help them prevent disease and live healthy lives today and for future generations. I am thrilled to be with you to talk about our 17th partnership, and it's with Berkshire Health Systems. This new partnership is designed to bring the award-winning Canyon Ranch Institute Life Enhancement Program here to the Berkshires. This national level announcement has been drawing a lot of attention, not only because who's making it, but also because it is the most comprehensive initiative to date to bring the Canyon Ranch Institute Life Enhancement Program to a community. This investment by Berkshire Health Systems is tremendous. We're very excited about what it's going to produce here. The program has already been effective in diverse communities, as Dr. Cremona said, ranging from the South Bronx to rural Missouri to Tucson, Arizona, and so many other communities. The health improvements among participants are both clinically and statistically significant, and our evidence shows that the positive health effects don't stop at the individual. As important as each person is, and as we all know in our own lives and our own families, it truly is about one person at a time. But when we can extend those positive effects to communities and to healthcare systems, that's even better. And what we've shown with this program is that each participant shares what he or she has learned and done in their lives with at least 8 other people in their circle, their family, their coworkers, at their faith community, at their neighborhood association. People talk about it. They get energized, they get passionate, and they pay it forward, what they've learned. So we're thrilled about working with Berkshire Health Systems, in great part because VHS is already so deeply engaged in community health and wellness efforts. There is no doubt that VHS was ahead of the curve in recognizing the value of prevention and improving healthcare and health outcomes. So the program we're launching today is evidence-based and it's multidisciplinary. What we're doing is transferring the best practices of Canyon Ranch through VHS health professionals to low-income and medically underserved members of the Berkshire community. The Canyon Ranch Institute Life Enhancement Program uses an integrative approach. So I mentioned multidisciplinary earlier. That's because it's a team approach. And what the team of healthcare professionals, and this is Berkshire Health Systems health professionals, will do together is advance health literacy, prevent disease, and improve health outcomes for the participants and the community through sustainable and state-of-the-art approaches to all the things that our moms and dads and grandmoms and grandpops always told us to do. Be physically active, eat healthy foods, be positive, be in healthy relationships with the people around you, and manage your stress. This program provides those curricula and tools and social support and measures along the way to do all of those things and to do them in tandem a little bit every day. So think about your own lives and think about how many people you personally know right here in the Berkshires who are living with a chronic disease, such as diabetes or depression, heart disease, asthma, arthritis. Think about that for a moment and hold those people in your minds as we continue here. Through this partnership, Berkshire Health System professionals, some of whom are in the room today, and who represent all aspects of the integrative health model, physicians, physician assistants, nurses, exercise professionals, nutritionists, behavioral health professionals, community health educators, and many, many more. They're participating in a specialized education program developed by Canyon Ranch Institute, and they will then implement right here in the Berkshires the best practices that they learn to measurably and scientifically improve individual and community health and wellness. And what's going to happen when they go out into the community? And they're not going to be doing this at Canyon Ranch. They're not going to be doing this through some sort of oversight and instruction from Canyon Ranch Institute. They're going to get the training and they'll have support ongoingly, but they're going to be doing it in the community and themselves because they know the culture and they're more than qualified to provide it. And now with the leadership of what Dr. Cremona spoke about, talking the talk and walking the walk that we have from Dave and his team, the changes that you're going to see and experience as the people you held in your minds and your hearts who have those chronic diseases, you're going to be seeing changes that would not have happened otherwise. The program itself is comprised of 12 group sessions. So getting down to the nitty-gritty here. The sessions that the patient participants go through include exercise. That's a surprise, right? So some really good physical activity, moderate to strenuous physical activity, depending on the needs and abilities of the participants. Cooking, both cooking together from healthy recipes, adapted recipes that people like, the recipes that are in their families, but let's adapt them to make them healthier. Stress management tools and techniques. Lots and lots of those. There's a lot of stress. I don't know if y'all noticed. There's a lot of stress. And it's a high time that we acknowledge that and learn the tools and use them to manage the stress. And there's also a visit to a grocery store. Where are the healthiest foods? How do I afford those foods? And then take them back and cooking with nutritionists, with registered dietitians to make the foods healthy and delicious. And then one-on-one consultations, so personal individual consultations between the patient participants and the health professionals. And all of this is based on looking at the patient participants' own data. We gather data all throughout the program, pre-program, or as our researchers tell me to say, at baseline. And then immediately after the program, 3 months after the graduation of the program, and then 12 months later. And so the delivery of the Canyon Ranch Institute Life Enhancement Program by the health professionals here ensures that we meet each and every participant where they are, not only in terms of their health status, based on the data that we gather at baseline, but also their culture, their access to healthy choices, and their education and health literacy level. So I want to talk a little bit about health outcomes, as both Dave and Dr. Cremona have mentioned some extraordinary changes that have occurred in other places where the program exists. Many of you received a packet that has a sheet in there titled Key Outcomes of the Life Enhancement Program. And across a broad range of health metrics, including blood pressure, cholesterol, depression, as well as physical measures, such as strength and flexibility, and behavior changes, such as eating more veggies and fruits and drinking more water. You can see the data in there of what has gone down, that we'd like to see go down, such as C-reactive protein, which is a measure of inflammation in the blood, such as systolic blood pressure, diastolic blood pressure. We'd also like to see people becoming more strong and flexible in their bodies. We measure all of those things. And these are health outcomes in this data, again, clinically and statistically significant data that sustain not just for a few days or months, but for the long term. And finally, I'd like to talk about the financials. For those of us who took to heart what Dr. Cremona just said about the unsustainable cost of healthcare, we really do need to look at the financial positive impact of the Caney Ranch Institute Life Enhancement Program. I'm just delighted to tell you that this is the first time that we're sharing this information. We've literally been crunching the numbers and analyzing the data for the past couple of months to be able to tell you what we've learned from the thousands of participants and the other partners in our other sites around the United States. So, of course, we're thrilled that the Life Enhancement Program is improving quality of life for participants. That's a tremendous value to society and to families to have around productive, loving members of the community and of a family. But then, when we ran the numbers using the scientifically accepted economic measure for the financial value of health outcomes, our data analysis shows that the Caney Ranch Institute Life Enhancement Program improves health and quality of life at much lower than average cost to achieve the same health outcomes in the United States. So to be specific, the Caney Ranch Institute Life Enhancement Program has increased quality of life at a savings of more than $3,750 per person, lower than the average cost for producing those same health outcomes across a range of other possible interventions. Those interventions include medication, surgery, hospitalization, and even as compared to other health and wellness programs. 1 year after a participant's graduation from the Life Enhancement Program, the savings for achieving those health outcomes increases to more than $5,750 per person. So you can do the math. Multiply by 10 participants, 100 participants, and so on. So 3 months after graduation, the health cost savings for 100 participants is more than $376,000. At 12 months after graduation, the health cost savings for the 100 people who participated equals $570,000. So for all of these reasons and more, we're very, very excited for Caney Ranch Institute to partner with Berkshire Health Systems. So thank you for having us here. And now I get the distinct pleasure and honor of introducing someone who I respect tremendously. For more than 30 years, Caney Ranch founder Mel Zuckerman and his wife Enid, Mrs. Zuckerman, or as they're affectionately known, Z's, Mr. and Mrs. Z, have supported programs and research dedicated to expanding the health consciousness of people of all ages and from all walks of life and cultural backgrounds. Mel is a living legend, and I see him looking at his watch because he gets pissed when people introduce him. It's just the truth, Mel. So Mel is a living legend, not only for bringing the integrative health approach to hundreds of thousands of Caney Ranch guests, but also because of his commitment to helping all people to access the Caney Ranch experience. So 20 years ago, in 1993, Mel and Enid established the Caney Ranch Healthy Living Scholarship Program so people could come to Caney Ranch and experience a healthy vacation. To date, more than 5,000 people have been awarded Caney Ranch scholarships. And in 2002, the University of Arizona College of Public Health was renamed the Mel and Enid Zuckerman College of Public Health in recognition of their important work as advocates of healthier lifestyles and disease prevention. And in addition to Mel's leadership of the College of Public Health, he serves on numerous boards and he's also been a trustee of Springfield College for more than 20 years. Ladies and gentlemen, Mr. Mel Zucker.
Well, the first thing of housekeeping here, technically we're adjourned already. So if everybody will just reset their time till 10:30, that will put this meeting on schedule. And I will be able to introduce Reggie at the end, and he'll have a little time to speak. Usually I'm the last speaker when we have meetings at the ranch, and I always get up and start the meeting by saying, "Thanks, guys, I don't have any time to talk." So now it's going to be your time. Anyway, thank you to all the previous speakers, and Dave, congratulations to you, not only for your own aha, but for the wisdom to see and take the initiative and be proactive in bringing a new level of health promotion and public health to Berkshire County. I'm sort of going to tell a story, a historical story. I wasn't quite sure why they put me on the program, because it really is all about the Institute. And so I'm going to tell a little story. Just in case any of you don't know any part of my personal story, I would imagine that very few of you in the audience. I'm standing before you, an 85-year-old man, probably in the top 1% of my age group for fitness, cognitively functional, besides being physically functional. Well, usually when I speak at the ranch, I make it a conversation, and I say to them, conversations go two ways. So if anybody's going to bring up a subject or ask me a question, the person to their immediate right has the responsibility of remembering where I was in my talk. Other than that, it's not so bad. But you know, I basically am a man who functions really well. I'm relatively, not totally pain-free, except for maybe some level of 1, 2, 3 levels of pain in my bone-on-bone knees after I do my 4 workouts a week, which include interval training, weight training, flexibility. But I only tell you that because I'm building up to why Canyon Ranch exists, why we're all here today, and I think we've had a meaningful role in the evolution of wellness and health promotion in this country. Some 45 years ago, just before my 40th birthday, my physician in Tucson asked me if I would become part of a study that was being done. Now, you know that data banks, the large computer data banks really hit in the late 50s and 60s. And in the 60s, the medical profession were beginning to do these random studies on a number of things. And one of this particular study was on giving certain tests, which were called biomarker tests, to people at different ages from 25 to 75. The purpose of giving the same test to these groups, which went into the thousands around the country, was to build a data bank so they could determine what was normal health at 35 or at 55 or at 75. And in order to determine normalcy, you put so many test scores into a data bank, and then you take the average, and that's the norm. Trust me, folks, in this country, you do not want to be abnormal. Now, why was I asked to be in that? Well, I was 40 years old living in Tucson, Arizona. I grew up in Hackensack, New Jersey, first 30 years of my life. And, you know, I thought to myself this morning, the there's a great likeness between that small town in northern New Jersey and Pittsfield. Going back in history, we've had about the same population. Hackensack today is about 44,000 people, not far different than Pittsfield, pretty much the same kind of demographics by race, by countries of origin, by socioeconomic. I grew up in a very poor family. I've worked since I was 13 years old, my first job being that of a Western Union boy, and during World War II, after about 6 months of almost collapsing every day, having to deliver telegrams with stars on it to people who were either receiving a telegram, not a visit from an officer or anything like that, being told that their loved one, their son or their husband had suffered serious injuries or perhaps had died. That was a pretty emotional thing for a 13, 14-year-old. So I decided to be a stock clerk and for Mack Drug back in Hackensack. And after that, I worked as a clerk during the time I went to college in a men's wear store, and then began while I was in college interning. So my first career was that of a CPA. And I didn't like that very much. In New Jersey, I was quite ill most of the time. I grew up with severe hypertension, which came genetically through my father's side of the family, but even worse, severe asthma, which was from my mother's side of the family, and basically was told as an 8-year-old child, and it appeared being in 1936, asthmatics should not exercise, and asthmatics should not get emotionally upset. And so I became one of these people that couldn't exercise, and because I had these restrictions, I was always emotionally upset. And then getting into a profession I didn't like, I solved everything by eating. And I became an ice cream buff in my 20s and all through my 20s, 30s, and 40s. My standard of care to get through my stress and to get by my life as it existed in those years was to eat ice cream every night. A half a gallon at a time. Freezer full of Rocky Road, Carnation Rocky Road ice cream. So, anyway, I went through this battery of tests at the time when I was 40. All through my 30s, I lost about 1,000 pounds. About 25 pounds on a deprivation diet at least 4 times a year. I was overweight, not exercising. I had ulcers in my 20s, diverticulitis, I had hernia, and those kinds of chronic diseases in my 30s. I wasn't a very healthy dude. And I asked my doctor why he wanted to put me through that set of tests. And he said, well, we need people on all sides. To get averages, he said, we need people who are less than what we would think of average, and those who are really in good health. So I worried about it because he said the result of these tests was to come back with a profile of where I fit at age 40. What did my health profile? Did it profile that of a 40 to 45-year-old, 50 to 55-year-old? And that's the first time I heard the expression, 1968, biological age. Yeah, that the body functions differently biologically than you might be chronologically. So you could be 30 years old chronologically and be in a body 55 years old. You could be 55 years old and be in a body 40 years old. And I worried about that until I finally got the call about 6 weeks later when the computer kicked out my profile, and my doctor called me up and said, Mel, I got some good news and I got some not so good news. Good news is that we didn't find anything medically wrong with you that we didn't know you had before you took the test. Thank you very much. The not so good news was that, and then there was this pregnant pause, and he said, your profile matches up more to a 65 to 70-year-old than it does to a 40 to 5-year-old. Now, as many of you, that should have been an aha moment if you got that kind of diagnosis. It wasn't quite for me because I didn't know I could do anything about it. I didn't go to the doctor and say, Doc, what should I do? And he said, you need to lose 40 pounds. I said, Doc, I lost 1,000 pounds in 8 years ago. He said, well, you gotta keep it off. How am I gonna keep up? Maybe you need to exercise more. What don't you understand? I can't exercise. And for the next 10 years, I continued to yo-yo. I did try to go to a fat farm to see if I could lose some weight real quickly, since he wanted me to lose 40, 50 pounds. I got there on a Sunday night, I hitchhiked out on a Wednesday. And I was prepaid for 2 weeks. Never got my money back. It was in Mexico. And so, and why did I hitchhike out? I have to tell you, and I'm not proud of it, but I tell the story all the time. Because I wasn't ready, despite that horrible diagnosis. I wasn't ready. I wasn't doing it for all the right reasons. And I found that out. In the morning walk of the first day, I could not keep up with the women. The first exercise class I went to, it was a stretch class. And I was the only man in the class. I'm sitting in the back of the room, and the teacher comes in, 9 o'clock, says, okay, everybody, sit with your legs straight out on the floor in front of you and your back at the right angle. And my legs were flat on the floor, and I was, flat on the floor. My head was on the floor. I mean, I could alter that by a little bit by pushing down on my hands and getting up, a little bit like this. And so after the embarrassment, every woman in the class, you're hinged differently, ladies, every woman got to at least her ankle, some got to toe, a few yoga types from Southern California. First of all, they got, a foot out in front of them. I ended up with my knees under my cheeks, sparring and grunting, and then went to another class. Right? So, at age 50, 10 years later, I knew I was having the big 50. And I just had lost my dad to lung cancer from smoking all his life. 2 to 3 pack a day camel smoker. And the last months of my dad's life were, if only I had listened. Only, if only, if only. I'm turning 50, and I said to my wife, I'm in the worst shape of my life. Get me back in a fat farm. Well, we went to a different fat farm. I went to a place in California where I checked in for 10 days and stayed 4 weeks. And there I had an aha moment, ending much like David did. My aha moment involved one major thing, because I found out I could exercise. And I want to emphasize through all of our programming, and every part of it is important in the wellness evolution. It doesn't work without regular exercise. I did my 12 top tenets of wellness when I lectured to my staff, to our guests. And I say, okay, don't smoke. Exercise regularly. Eat a healthy diet. Exercise regularly. Maintain a healthy weight. Exercise regularly. Get the message, okay, I could go on, but I'm not going to. And I got there and through some testing, and which I didn't know. Was testing. The first day, since again I was the only man at the Fat Farm Fitness director there, took me under her wing and wanted to prove to me that I could exercise. We took a walk. We took a 1.5 mile walk the first day. It took me 37 minutes. And a book written by Dr. Kenneth Cooper, the Cooper Institute in Dallas. And he wrote a book with a physicality test in the early 70s that showed if it took you more than 24 minutes to go 1.5 miles, you were in a lower 10%. At 37.5 minutes, I didn't even crack the lower 1% on the physicality test. 10 days later, this woman and I jogged 1.5 miles in 11 minutes and 38 seconds. That put me in the top 5%. Woo, you talk about ahas. Okay? And immediately I felt my health changing. Okay, I was medicating myself differently, right? For the asthma. I was breathing differently. I was moving differently. Everything was changing. I called my wife back. I lost 13 pounds the first 10 days. I lost 30 pounds in 28 days. I stayed for 4 weeks. By the time I stayed for 3 weeks, I called my wife up and I said, please, come and join me. She said, how come I don't need to lose weight? I said, because I found what I want to do for the rest of my life. I felt that different. Talk about empowerment. That's what wellness is about. That's what motivation for wellness is about. It's about personal empowerment. And folks, don't kid yourself. We can talk about communities, we can talk about large groups. It happens one person at a time, and hopefully it trickles down from there. People are motivated by how they feel. We got back from this place in Ojai, California on April the 23rd, 1978. On May the 7th, 2 weeks later, I found the site of the first Canyon Ranch. That's how quickly it moved. I had been a home builder and developer in Tucson, so I had my own architectural staff and so on. We opened up 21 months later in December of 1979. That's how quickly it came about. There was, if any of you remember the 70s, there was no consciousness about prevention and wellness and nutrition and fitness. That didn't exist. It wasn't out there. Maybe there was a few fringe people that spoke about it on the side. We decided that we were going to build ourselves our own ecosystem to stay healthy and hope that we could find a few other people that maybe wanted the same thing. By the mid-80s, we knew we had a tiger by the tail. And in 1984, at the behest of many of our guests who were from the East Coast, about 60% of our guests were from the Northeast corridor between Boston and Washington, I began looking on the East Coast for a site. My first trip, which was 4 weeks on the East Coast, actually started right on the border of Connecticut and Massachusetts. I think it was on the Connecticut side, I'm not sure. I looked at the estate of Beatrice Straight, a movie actress at that time. And it extended through New Jersey, Bucks County, Pennsylvania, Virginia, Charlottesville, Roanoke, North Carolina, South Carolina, Georgia. And in 1986, I heard about the Berkshires. They were very inadvertent app. One of our guests in Tucson was Joseph Duffy, who was the chancellor of the University of Massachusetts at Amherst at the time. He said, I hear you're interested in doing a place on the East Coast. He said, I'd love to have you come to Hampshire County, but you ought to look at Berkshire County. And as a result of that, I came to Berkshire County, and it was like love at first sight. We couldn't have made a better decision. We didn't find the right site immediately. It was in February of '87, and 16 inches of snow that I first set foot on the estate called Bellefontaine, and in the mansion that had a caved-in roof and caved-in walls, and decided to make the Berkshires the site of the next Canyon Ranch. And we are so delighted that we did and to be here. In the early 90s, we began our scholarship program here, and until the recession set in a few years ago, we continued bringing groups in. And now the work of the Institute, and with Rich and Jen there since the last 6 years or so, their ability to manifest everything that Enid and I dreamed about in bringing this to underserved communities has been met and more. And so I'm really delighted that we can participate and be part of this. You know, all of you need to know that science has proven, empirically proven, that it is easier to preserve health than it is to repair. Our programs can light the path to optimal health. People still have to walk down. Thank you. I think I'm always the last one. I don't have to introduce anybody, but since I'm not this time, I'd like to introduce to you Reggie Cooper, the Managing Director of Canyon Ranch in the Berkshires, and the best hire I've made in the last 15 years.
So people sometimes ask me why I'm so happy, and I think you see what my boss looks like over here, and what it's like to work with him and be inspired by him. That's the reason right there. What an amazing person Mel is. And Dave, thank you for your kind words. I feel like a bit of a freshman when you talk about commitment to community and service and organizations. When I look out in the audience and see so many veterans who really have driven this county, moved this county forward in so many different facets, different areas, and really the amazing place that it is. So at Canyon Ranch, we get to do really astounding work with people who come to see us. We get to talk to them about their health situation. We get to talk to them sometimes about their fears of things that might present in their lifestyle. And we're able to give them a real sense of hope and optimism, which helps to change their outlook and in time their health profile. We get to see people come in for transformational experiences, ones where they're almost unrecognizable, or we end up taking to Steve Valenti's to get a suit on the way out of town because they've changed themselves that much. And we have people who come just because it's a place that really grounds their soul, grounds their heart, and makes them able to do the hard work, which is to live a healthy lifestyle. The downside of what we do, we have a very complicated model that we offer, and it's a very expensive model, and unfortunately limits who can come to these Canyon Ranch life enhancement properties to a certain rather elite group of individuals. So as we look at what we could do in the community, we've done various programs over the year, but what we're talking about here, what we're launching here, is really a significant event, and something, as Jennifer talked about the numbers, that's going to make a really profound impact on our communities. It might not be people who live in our neighborhood. It's going to be people that are in our community, people who we work with, people who our kids go to school with, that don't have the same access as so many of us do to information about health and the opportunities to put that in our own lifestyles. So the reason this came together is sort of an interesting coincidence. Jennifer was with the Canyon Ranch Institute and would send out information about the program, about the different programs they were doing. It's amazing items. And she was in Boston speaking at the Harvard School of Public Health, and she called me up and said, I'm going to be on the East Coast. It's a long way from Tucson. Any chance I could come stay for a couple nights at Canyon Ranch? I said, that's fine, but I'm going to have to charge you a rate. And the rate is, I want you to come and give a talk to the staff about the work that the Canyon Ranch Institute does. Because at that time, we were starting to get results out of the South Bronx in terms of what was happening and what was being established. So Jennifer came, and really, I was amazed, and so were so many of our staff, and also we talked to our guests about the work that was happening and the numbers, the results that were there. So it wasn't just a very philanthropic, we're doing good work. It was actual results in these communities. People are seeing changes. Their depression is being reduced, and their bad blood numbers and other restricted outcomes are being reduced. So I was really moved by that. It was about the same time that I think Dave and I had started to work together after Dave had received his diagnosis and was interested in what he could do. And we spoke, and I said, Dave, you have full access to whatever you want to come and do at Canyon Ranch. If that will help you. And we teamed him up with Dr. Geyer, Dr. Cindy Geyer here in the front, who's our medical director, as well as the rest of our staff. Came and spent some time and really connected with, I think, what he could do and how it could affect him. And that's what's led to his transformation. So as I thought of those two things, here's this amazing program that, boy, how would we ever have that in our community? And then here's Dave having this real aha moment, life-changing event. Dave and I started to talk, and I introduced the Life Enhancement Program to him that Canyon Ranch Institute does. And from there, because of the hard work of so many people, especially Ruth and the whole team at DHS, along with the Canyon Ranch Institute group, we find ourselves here today. It's a place that I probably, if I could have wished for it, I would have. If I could have dreamt it, I don't know that I could have dreamt as big as to think that BMC would be able to carry a program like this that's really going to help our community. So it's a real honor to be part of this. And Dave, thank you so, so much for your amazing, amazing commitment to this.
I hope you've enjoyed the opportunity to hear from our partners from Canyon Ranch. We're grateful for spending so much time with us, apparently slightly more time than we get clean. We'll do our best to get the charter soon. Before we go, I'd like to just point out, we talked about core leaders during the time. They're here. Could you all stand up for people who would be part of the program? So the challenge that we face is significant, and these folks have agreed to be part of this program. And you do need to know much of it will be above and beyond the work they do every day. It's a significant commitment to our community that they're comfortable making, actually enthused about making. And it includes several members of our executive team. We think we have the same amount of responsibility as clinicians to stand up for our community. So we're looking forward to giving us some funding I suspect in the next couple of years. I also want to recognize and applaud you for the work she's done. We appreciate it all. Moment we're going to take questions from the media if you have them. We'll ask Ruth and Dr. Mark Pettis to come up and do that. But Dr. Pettis, many of you know from his years of service here, he left us for a short time, but he's learned that it's very hard to escape. He left for a while to go over to some wayward youth thing or something. He'll find himself, he went home in Albany, and now he's coming back and joining us to serve in no small part to help us lead this effort in our community. And we're glad Mark's here. And you know, it's really special. I noticed Tim Jones is here. You may not know Tim, but Tim, could you stay up for 1 second so we can see who you're running? I was really interested to leave. I didn't get a chance to say who you were. But Tim is the new head of Northern Berkshire Health Systems and North Adams Regional Hospital. And he has been a good partner since his arrival, and I appreciate him coming down. Thank you. So Ruth and Mark, could you join us? And we'll take 5 minutes of questions from
While they're getting set up, I just want to say, Dave, Rebecca, that isn't what I wanted to say, but I wanted to say.
With such like disrespect. You thought it was the other day.
Aren't we fortunate right here in Berkshire County to have this perfect storm of leadership and people and programs to improve the health of our community and transform lives? Can we just give a round of applause? And I know Dr. Geyer has been introduced. The other person that is unfortunately traveling today and not able to be with us is Dr. Mark Laponis, who's the medical director of Canyon Ranch. And he also used to be on the medical staff here at Berkshire Medical Center. So we're very familiar with one another everywhere we go. There could be another word for that, but I won't use it. But I want to thank this leadership team for being here today and for their vision, their personal commitment and capabilities, their personal stories and professional stories, and frankly, their grit and determination that each one of them displayed and talked about that's part of the foundation that will help transform our community. We are so fortunate to have all of you part of this effort. Just wanted to add, I've been here for 27 years, and I've worked on a lot of things that I think are very important and critical to healthcare and health for this community, but nothing as exciting as this. And I dare say someday we will look back and say, this effort has been the most important effort for for the health of this county. And I think with this leadership team and Dave's additional leadership and vision to transform the health of this community, I think we will achieve our goal of being one of the healthiest, Dr. Elrod, the healthiest community in the United States of America. Because it's our goal, and because we need everybody working individually and together to improve health, we're so fortunate to have all of you here today to be part of this, to hear firsthand, and to carry this message out after the meeting. And I want to extend a special thank you for the media, because as big and as steep as this room is, the whole community couldn't fit. And we're really dependent on the media and appreciative of the media for your role in helping spread the word about the importance of health, the importance of this initiative. And really, now, this news conference is going to be dedicated to you, the media, so you can ask whatever questions you would like related to this topic. And I would ask you to identify yourself by name and your organization, and I will do my best to repeat the question so all of you in the back can hear it.
Tony Gold, Rescue Berkshire. Can you tell me a little bit about how people are going to be selected for this program, when it starts, when it's actually going to start, and if there's going to be a cost to people working on it?
So Tony's question is, how are we going to select the folks that are going to participate, when will it start, and will there be any cost to the people participating in the program?
I think Dave and I can handle that, okay?
You go first.
I'll go first. So one of the basic tenets of the Canyon Ranch Institute Life Enhancement Program is that no participant ever pays to be involved in the program. And that's why it is so key that Berkshire Health Systems is investing the resources to make that possible. So Berkshire Health Systems is investing the funding to pay for every aspect of this program. Some of that funding is to pay for hard costs, like the food that will be served in the program and different things that are needed to make the program work, the materials and so on, and the blood draws that will be done, the measurements that will be done. The other part of the Berkshire Health Systems investment is in the time of its staff, as Dave was talking about. The healthcare professionals, the core team who will be trained and then who will deliver the program, they are BHS employees. And one thing I'd like to mention is this is our first partner, not only investing this time and treasure at this level, but also who already had on staff the entire integrative team. It's just about them being brought together. We've never had a partner that didn't have to go out and find an exercise professional or find one of the other core team members. This is already an integrative approach. It's just about bringing everyone together. And then in terms of, the next question I think had to do with
How would you be selected?
Right. Oh, I'm just asking them. What was his next question? So the participant recruitment is done primarily through healthcare professional referral. So from a nurse practitioner or a physician assistant or physician referring their patient. So let's say that I'm Dr. Pettis' patient, and Dr. Pettis has just said to me, you know, as a 24-year-old woman, there's some things that you could actually do better. And let's say Dr. Pettis has identified that I'm not somebody who's ever going to be able to afford to, for heaven's sake, I'm not going to be able to afford to go to Canyon Ranch. I'm also not going to be able to even afford to maybe buy a gym membership. I can't afford the $80 or $90 or $100 a month. I don't think I can afford healthy foods. So the point is that I'm somebody who is low income, and I'm Dr. Pettis' patient. He says to me, you know, we have this great new program, and some of our best professionals are offering it. It's no cost to you. Go talk to those people. Go talk to our core team lead, and she'll tell you more about it. Well, guess what? You know, I think Dr. Pettis just is the greatest, so I'm going to do what he says. That's how the initial referral will happen in recruitment. What we see happening in most other communities, and I anticipate will happen here, is then a much more organic approach to recruitment. What we see happening is the first group, the second group, and so on, they start getting so excited. Those participants are seeing these life changes and how much happier and healthier they are, that they're like, I need to get my sister in. Can I tell my boss about it? You know, maybe my husband will come. The men are more difficult, just so you know. It's more difficult. The women are smarter. It's more difficult to get the men in. Once we get them in, they're living it and they're loving it. But a lot of times it's the ladies who build it up.
It said low income.
Absolutely.
So is there a threshold that you go to for this program? Is it cut off point somewhere?
It's different in every community, and the community leaders and the partner, they know what low income means in their community. They know what low socioeconomic status means. And the reality is that the greatest indicator of poor health outcomes, low health status, is going to be low socioeconomic status. But Dr. Pettis and all of the other physicians and health leaders here, they know that the patient is somebody who needs the support.
So there's no standard cutoff point set for Berkshire County at this point, where someone would be over.
No.
That's going to be determined.
That it truly is done by the partner. They know their community. We do not, as Canyon Ranch Institute, impose that. We don't have a prescriptive approach. So I think that's a great question for Ruth to think about. But honestly, in every other location, it's not been a scientific measure. It's people know who needs things.
I think another way to say it, Tony, is we're going to reach out to people that will benefit the most from these services. The other answer to your question in terms of when will this start, the training of the team will happen over the summer. Participant selection also over the summer, and we expect to run the first program in the fall. And the other point that I wanted to make is one of the reasons why there's no cost to the participants is obviously the Canyon Ranch Institute model, but the health system is committing $500,000 to this effort over the next couple of years.
So,
Bmc Cr, iBerkshires.com. How is this going to affect Berkshire Health Systems? Are you going to be adding employees to make this operation forward? Where is this program going to take place? And how many people will be able to participate at a time?
Okay, so Andy asked about 5 questions. And I think the gist of it was, how is it going to affect Berkshire Health Systems? Would be hiring any additional people, and where are we going to offer the program? And Dave is conferring in the hall, so I'll take a stab at that. We will offer the program probably on campus, but there's also a chance it'll be done someplace in the community. We want to make it as convenient for the participants as possible. We're not anticipating adding any staff to do this. The folks on the team are doing this within their existing work commitment, and as Dave mentioned, with additional time. That's how committed our core team is to this project. So this will be done within our existing group of employees. And in terms of how will it affect Berkshire Health Systems, we expect this to be having a huge impact on Berkshire Health Systems. We deliberately picked people on the team that are involved in our community and our wellness programs, but are also involved with providing patient care back here at BMC. So we have people in cardiac rehab, in diabetes education, in behavioral health, in nutrition services, because we want to try to take everything we learn through getting prepared to offer this for our community and integrate it to the extent that we can in our day-to-day work of taking care of patients. So we expect the impact to be huge.
how many employees do you expect right now?
I think there are 16 of us.
They range from, as you said, cardiac, dietary, to doctors.
Yes, and I did a terrible job. Yes, how many people do we expect to be involved? And that was 16 people. Dave, do you want to say anything about thoughts about future growth?
Tony, it's our expectation that we'll get this program off the ground. If there's under 16 of us, there'll be a limit to the work that 16 of us can do upon graduation. Hopefully, we'll hold the teams together and keep doing more folks. We're expecting in the fall to talked to a couple of other potential partners to try to expand upon the initial capabilities, which would be more limited than we would hope to see over the next 12, 18 months. We'd like to be in all parts of the county. We'd like to do something now with our hospital Fairview, and we expect to be able to talk about that one in the fall. This is, we view it as just the beginning, not the entire program.
And just one second, Dr. One on that.
I just wanted to add that when we designed the program, we were very sensitive to the diversity of the communities that we'll be working in. So really the content is adaptable to almost any physical geographic space. You can do it at school, a YMCA, a church, a hospital, the content stays the same, and we adapt accordingly based on the resources that are available.
How many people will be eligible? How many participants do you have in the program? Do you have a number for that? Some hundreds?
So the question is how many people will be able to participate? The program, is that? Each program, each class, if you will, is 20 participants at a time. And we hope to offer 4 or 5 a year, and if we can expand with some additional core teams, then we will expand beyond that. And as Jennifer mentioned, each person has a multiplier of 8 people, so we expect to have fan out and affect many people very quickly.
So the two parts on this goes, and that's a bigger, one is the addition of partners, and I assure you, that we'll be able to do that. So when you look at the limitations of the first group, that expands over time when we start other sessions. That's important, one of the other benefits that this will help us with is everything we learn in this process, the Institute is kind enough to allow us, with their permission, to use and integrate into all of the programs we provide to our community. So you can see how it's not just the direct participants that are out of it, the entire community will ultimately benefit as it becomes more and more part of it.
Another question I
Can you wait 1 second, Ms. Madeline was trying to get a question in.
Yeah, I was just trying to clarify something. It's 40-hour sessions, 40-hour total session, 12 3-hour sessions. How many times a week is this?
I'll let Jennifer answer the question of the specifics of how the sessions run.
Sure. So in different locations, those 12 sessions are done in different periods of time. So for Berkshire Health Systems, what we've been discussing is that it would be over a period of 12 weeks. So 1 session per week for approximately 3 hours per week. But we have had with the Cleveland Clinic, they did 8-week sessions. And with South Bronx, they do it in 6 weeks. So it's different in different places, and it really can be tailored to the participants of the group and, of course, the core team's schedules and capabilities. Then the other part of it is the one-on-one sessions that the core team members do with each of the patient participants. And one of the things that's extraordinary about those one-on-one consults is that they're long. They're not the 7 to 10 minutes of meeting with a physician or meeting with a pharmacist or whatever. These are 1-hour sessions where you really sit there and take some time with a physician, with a nutritionist, with a behavioral health person. And those sessions are sprinkled throughout, whether it's a 6 or 8 or 12-week model. In addition, a lot of what we see come up in the other sites is that the group participants and their core team leaders, they come up with other fun stuff to do. They end up doing walking clubs, go to the community pool. They get together and say, let's do the grocery store trip again and support each other. How to get these healthy foods and stay away from stuff that's got all the sugar and fat and everything else. They come up with all kinds of fun, creative things to do, dance parties, just ways to get together that are healthy and fun. We go to baseball games a lot in New York.
I think we have time for one more question, if there is a question.
I have one more, just sort of asking something we talked about earlier about the health outcomes and some of the other places you established the program. How does Berkshire County rank health-wise compared to some of the other places where this program has been established?
So this is a question about health outcomes and health status and how Berkshire County compares to some of the other communities where the Canyon Range Institute partnership is up and running.
It's a great question, and Berkshire County fits right in there, and that's the good news and that's the bad news. The good news is that Berkshire County has decided, because of DHS's vision and investment, to address the health disparities, the health inequities that do happen here. And all the healthcare professionals asking out of your heads up and down, because you're the ones who see in your emergency department, in your hospital, the people who are lower income are the people who are coming to you again and again for their behavioral health issues, physical issues. And it's absolutely true what Dave said earlier, that out of Massachusetts' 17 counties, Berkshire County is number 14. That's not where we want to be in a couple of years. And by number 14, I represent my health status outcomes.
Right.
Yes.
Just to answer that very briefly, I think, as many people here know, there are some very challenging psychoeconomic issues in Berkshire County, and it's never been harder to be a more effective steward of self-care. And so as part of this group, I just need to say that I am so profoundly impressed with the magnitude of compassion in action here. This is about taking what compelling science is more than clear, and its inspiring message of the potential that all people have to be more effective stewards of self-care. It's recognizing that community capital and social capital is ultimately what leverages the opportunity to manifest that in any community. And so from my perspective, this is a partnership that really lays a profound foundation for making that possible. And we know that through social sciences that these become infectious by their very nature. Once you begin to inspire a certain level of engagement, and I think as Mr. Zuckerman eloquently put it, collective consciousness, you begin to see that lever tilt. And as people manifest in that way, I think tremendous things are going to happen here. I could not be more excited to be here in this place and at this time. I'm very grateful for those that made this possible.
So in closing, if any of you would like a minute or two with any of the individual leadership team here outside this door, we can accomplish that. And I just want to wish you all your own aha moment as we all leave together in search of aha moments for ourselves and for our families. And thank you for being here.
All our colleagues for staying to the end, we appreciate it. And I do want to say that I saw your training, you're a vascular surgeon. I want you to know we do have an opening.